Guys, welcome back to Medical Coding with Blue. Today's episode is all about the expenses of being a medical coder. If you are brand new to my channel, welcome. I am Blue. I'm a medical coder. Okay, guys. Now, who you are certified with is going to play a big part in how much money you have to spend in order to maintain your certification as a medical coder. Now, I did a cost comparison of the two main medical coding certifications, the American Health Information Management Association and the American Academy of Professional Coders. I have done a video on this before. However, since that video, there has been an update to the membership cost to both associations, all right? So I will start off by saying this. You only need to be certified through one association when you are starting out. When you are starting out, you have no idea what you're doing in this industry. You just need to start out with one certification. I will always say this. Now, we'll talk a little bit more about why in a minute. But if you are with AAPC, I'll start off with them, the American Academy of Professional Coders, you have to pay your membership dues every single year that you hold your certification, or they will revoke your credential. You do not have the option of not being a member. You have to pay every single year. The current membership dues for AAPC, the regular dues, right? Not the student dues, but the regular dues, is $205. It's gone up. Okay, it went from $190 to $205. So it has gone up, and you do have to pay this or they will revoke your credential. Now, if you are with the American Health Information Management Association, that you have the CCS, the CCA, or the CCSP, the current professional membership, because they have different tiers to their membership, but the professional membership is the one that I recommend for new people when they're coming in. The professional dues are $149. With it, it includes the Journal of Ahima that's online. They used to send it as a magazine, which I loved, but they took that away. So now it's online. And the local affiliation with the component association, like for your local area chapter. 5 complimentary CEUs and 50% off credential maintenance, and then preferred pricing on Ahima products. But they have another one, is the professional premier membership. It is $199, right? So $50 more. This one includes the Journal of Ahima Plus and free toolkits, member exclusive online community, and the local component association. It also includes 8 complimentary CEUs annually with 50% off credential maintenance. Preferred pricing on all Ahima products, conference perks, and members with more than one credential will receive each additional recertification for free. So for those that are with Ahima and they have multiple credentials, this is a better deal than the professional membership. But again, like I said, if you are just starting out and you have the one certification with Ahima, then obviously if you want to go with the professional membership, I totally understand that, because that makes sense. However, when you start to have more credentials, and I'll get into that in a minute, then this may be a better deal for you. So it really all depends on what you want to do. If you do not pay for a membership, they will charge you separately for reporting your continuing education units, all right? So it's just a separate fee. It is not $199. It is not $149. It's just a separate fee. And that's just, it's understandable because it is like an administrative cost for them, okay? I will also say this. A lot of people don't talk about this. The American Health Information Management Association is a non-profit organization. Non-profit. AAPC, the American Academy of Professional Coders, is a for-profit organization. So there's a difference in the business models, okay? When you go on the American Health Information Management website, association website, you will see that it's a lot of like news articles and things like that. That's all that stuff up front. You kind of have to poke around for the Ahima store, right? And that's where you can find all of the online courses that they have and all the books and all the other products that they have. With AAPC, when you go right to their page, is immediately, what can we sell you? They have all of the programs listed. They've got all of that. it's a little bit more easier to navigate, because that's the first thing that you see right when you go on there, is about the memberships and all the different credentials that they have to offer there. Now, aside from the membership dues, there is continuing education units. How many certifications you have is going to be a direct relation to how many continuing education units you have to produce. Now, both of these associations offer a few CEUs with the membership. So that's great. So you have that. Some employers will offer you CEUs, continuing education units, as a condition of employment. And that's a great employment perk to have, right? Because it saves you some money. However, there are some places that they don't have that, and it's on the individual to find their own. So if you can find free ones, and there's some free ones out there, I recommend looking on LinkedIn. There's a lot of leads there. I do not post about free continuing education units, because if you guys want them and you need them, you'll be able to find them. Guys, it's about doing your research, okay? So that's why I tell you they're out there, but it really is on you to look them up, okay? So there are some free ones, but I will say this. If you have certain specialty credentials with AAPC, they're going to require certain CEUs. You can't just go around willy-nilly getting the free ones, because they may not fulfill some of those continuing education unit requirements for those specialty certifications with AAPC. Now, I'm going to talk about this just for a second here. Let's just talk about this realistically, and let's be adults about this. Number one, I'm not trying to hurt nobody's feelings. I'm just trying to be truthful, because there's a lot of people out there that are brand new. They get taken advantage of and sold a bunch of specialty credentials. Aside from the CPC, they're sold the CPB, the CRC, the CPMA, and all these other credentials that they don't need, because they don't have the experience. They don't have the industry knowledge and know-how in order to really say, hey, I have this credential and I can do more than just pass a test. I have experience to go along with these credentials. I do not believe in brand new medical coders having a whole conga line of credentials after their name just because they want to feel like they know more or they're more worthy in the industry. Having additional credentials more often than not, especially when you're brand new, will not get you more money. What gets you more money is time and experience. That is what will get you more money, not the amount of credentials you have on your name. I have had one credential for 13 years. I had the CCA, and I ran circles around people who had degrees, who were nurses, who had multiple credentials, and I still outmade them money-wise, just having the one credential. Why? Because I had a lot of experience to go with that one credential, and I was able to do a lot of things with it. So rather than be bogged down with a bunch of credentials that you don't even need, I'm just trying to save you guys a few bucks here, okay? And I know some of you are going to ignore me and be like, no, I still want to get them. That's okay if you want to still get them. But if you look at it like this, you can have 3 or 4 or 5 credentials on your name. You're still going to make the same as your counterpart at work. And you have more CEUs and more money you have to spend out in order to maintain all of that name. Keeping up with the Joneses credentials. Because CRC tests you on risk adjustment, that's diagnosis coding. Guess what's covered on the CPC exam? Diagnosis coding. CPMA, again, auditing. That's a little bit of the advanced side of auditing. But I've heard of people who have the CPC, and I asked them, well, what would you do with it? Oh, I don't know. They just told me to get it. So if you don't know what you're getting, don't get it. And if you want to have additional classes in billing and you want to get the CPB, now here's the thing with that. If you want to take the class to get the knowledge, that's great. I'm all for that. I think that's wonderful. And that's an additional expense, is getting the classes that you want in order to get that kind of specialty knowledge. You know what I'm saying? Like if you are an orthopedic coder and you want to take an orthopedic class, and that's good and that's fine. You do not need to get the credential to go with it just to say that you know the stuff, because you can actually just put that class on your resume, and that's just as good. Because these employers, when you look at those job listings, what are they asking for? one of the 4 main medical coding certifications, or they're asking you for your degree, the RHIA or the RHIT. So don't make it so expensive on yourself, because it will get expensive. This is a long-term investment. This is not a, you're one and done, and then all of a sudden you paid your membership dues, you got your certification, and then now you have to maintain your continuing education units. Oh yeah, now you're getting another credential, you have to have more continuing education units, and then you got to pay more money out. So save yourselves money. If you want to take the classes, those specialty classes, just to kind of get better, Ahima has some, Aapc, of course, they love theirs. You can take them, but again, you don't need to get the certification just to say that you have the knowledge. A certification in those instances just says that you can pass a test. It's an additional fee for that test, and it's additional time that you have to spend studying. And a lot of times people, they want to fuss about all the things that they have to learn just for the CCS, CCA, or CCSP, or the CPC. But then they want to get involved in these specialty credentials, and then when they get out in the real world and they're applying, a lot of times they're not even going to get a job that even, needs that knowledge. So when I hear people say, well, I want to be a behavioral health coder. Okay, well, why don't you want to learn all of the coding so that you can have all of that knowledge? Because specialty coding is not just about that particular specialty. When I am coding for ortho and podiatry, because those are my clinics, I still need to know about internal medicine, because I still have to know about all the disease processes and everything else. I still have to know about the endocrine system, because we have diabetic patients and we have people who have all peripheral vascular disease. When you have those types of things, it can affect the bones. Everything in your body is interconnected. Okay? So that's why you don't see me running around with the specialty orthopedic certification on my name, because I don't need it. I have the experience to back up what I have. I have 2 credentials, yes. I have the CCSP and the CCS, because I got the CCSP first. I got stuff going in the background, guys. That's why I had to get it. And I had to put my CCA to bed. But I got my CCSP first, and then I wanted to go for that mastery, so that's why I got the CCS. And yes, I will be getting additional credentials in the future. But I will say this, those credentials that I'm going to be getting in the future have nothing to do with medical coding. Nothing. They're just different things. So that's something that you need to think about before you start investing into getting all these other specialty credentials. Because I have seen people who have multiple credentials on their name not know a lick of coding. And according to their conga line, they should know a lot. But they don't, and they can't even explain simple basic things like injury coding. If you can't explain simple basic injury things like injury coding to me, and you got a whole bunch of credentials that says you should be able to, unacceptable. I'm just saying. So watch where you're investing your money. If you want to invest again in a class, that's great. HC Pro, they have a lot of boot camps, right? They have those 60-day boot camps. They do have inpatient coding boot camps. I took that one, and I also took the CDI boot camp that they have. There was a huge difference between the two. But I will say those classes run about $1,100, give or take. Don't quote me because it's been a while. But at the time, it was about $1,100 each, right? So when you're looking at, okay, $1,100, what are you learning? You're only getting 60 days to learn that stuff. So it was a lot. The inpatient coding boot camp was great. It filled in some of the other things that I needed to learn, but it was fast. But I will tell you that CDI one, the CDI course I took, that almost took my my rear end and handed it to me, because it was a difficult course, but I made it through. And so that I was very proud of. But again, that investment involved time and money. And when you invest that much time and money into what you're doing, that says a lot, But with that, I got continuing education units. So, I mean, that's wonderful, So really, when you're taking these additional classes, make sure that you can get something out of it, like either knowledge of more specialty for whatever you're at, or that it's going to give you a good amount of CEUs, because that's how a lot of people will get their CEUs that they need. They will attend conference, which is another expense. I am not high up enough on the food chain for my facility to have them pay for me, so I pay for it out of pocket whenever I go to conference, and it's a few thousand to go when you think of the hotel, the air, and the conference itself. To me, it's worth it because that's me investing in myself and my knowledge, and that has helped me. Because what I learned there, I bring back to my facility and I help other people who need it. Not only that, I share it with the people that I know, obviously, on the channel. So with that said, again, that's another expense. But that's a good expense because, again, when you attend conference, you're not only learning things because you learn all day long, right? But you're also networking and making those valuable connections. I have made wonderful connections. And to me, what I've spent on going to conference is worth it. To have those experiences and to make those connections. And those connections that I've had for years now. And so I'm very proud to know these people, and it's wonderful, you know. So that's an additional expense of being a medical coder. You have to continually invest in yourself. And if you don't want to pay for like a class, there's plenty of free resources out there that can help you be a better medical coder. As far as like if you want to look at your particular specialty and do more research on it and get better with it, you can look at your CPT manual. You can look online for those particular association websites. When I was coding for the pulmonary clinic, because I had to go and rescue them, I went to the American Lung Association because I had never coded specifically for the setting of pulmonary. So I wanted to see what were common procedures and what was the disease process about and things like that. I do know the disease process, but I wanted to get more into detail about it. So again, that was my time spent on that website. And it was time that I was not at work, okay? It was time that I invested on my own. And so when you think of expenses, people think of money, but I also think of time, because time is very precious. It's valuable, it is fleeting, and once it's gone, guys. You don't get time back. That's why I don't believe in getting down on myself about certain things. You know, whenever when I can't remember something, you know, about a particular subject, I just go back and I learn it again, you know, and so that's what I do. And that's what I hope to pass on to all of you, is that you have to take this stuff and this time seriously. And the amount of money, you got to be very careful about what you're spending, because you should be able to enjoy your salary. You should be able to enjoy it without having to worry about the extended expenses of all of these things, right? Your credentials and everything else. Now, I did see something about a hardship thing on AAPC. If that's you, you may want to check that out. I just didn't research it for the show because I wanted to just get on here and talk about the expenses. But if you need that, I mean, that's just something that you have to make sure that you plan ahead for, okay? You have to make sure, because you never know from one day to the next, right, guys? And so in order to protect what you have, and this is going to be your bread and butter, basically, you know, with this credential, you have to take care of it. You have to maintain it. And you have to make sure that you're still getting out there with learning the updates and everything else. So that's part of the expense of being a medical coder. Some of the other things, of course, are books. Sometimes your employer will allow you to order books, but you have to let them know because they don't know unless you tell them. And that's what's so great when they're ordering books at our facility, is that sometimes I'll ask like, hey, can I get a specialty book? They're like, yeah, sure, which one? And I'm like, oh, okay. And so I'll tell them what I need. And they'll get it for me. And so that's what's really great, because that's an additional expense, because these books get expensive. They're like $149, you know, for a good coding companion. Coding companions are $149 to $199, and sometimes they're more than that, depending on where you go. But that's why I'm always looking out for good deals whenever it comes to books, because I shouldn't have to pay full price when there's a better price out there. And so I'm always about that. You always have to look for the best price. You have to do your research and make sure that when you are looking around, that you're looking for something that's highly recommended. Like, you know, when I talk about the AHA, the American Hospital Association ICD-10, CM, and I want to say ICD-9 because I was thinking about that earlier. ICD-10 CM and ICD-10 PCS Coding Handbook with the answers. You know, that's a very valuable book when you are learning. And even when you need to do a refresher, it's also a great, it's a great resource. And so an expense like that on that kind of book, to me, it would be worth it, right? And sometimes your employer will supply you books, your coding manuals every year, and sometimes they don't. It really all depends on your employer. That's another good question to ask when you are in the interview process is, you know, are books included or do you have to pay for them yourself? Some people will ask me what kind of computer. A lot of times the computer is going to be supplied by the employer if you're working remotely. I've never had to use my own computer, and I've worked remotely twice. But I do have my computer that I use. I did leave the link for Amazon and the affiliate link in the description box below if you are interested in that. To me, my computer works just fine. It's nothing fancy, but I don't need anything fancy when it comes to computer. I just need to be able to connect to the internet and do my research. So, but yes, so look around for deals when it comes to books because, again, it can get expensive. The tools that you use are going to have a direct effect on your ability to be able to come up with the right answers and to be able to share your knowledge and share it well, okay? Coding companions have helped me when I am talking with providers because they sometimes are like upset when I show them a code in the CPT manual, but when I show them the code in the coding companion, then when they see all the other information that correlates with it, they're like, oh. And so they tend to calm down a little bit because then they can see everything all in one place. So that's why I say coding companions are a very good investment, but I would suggest that for people who are in specialty clinics and they kind of need a little bit more information, I would really recommend getting something like that. Okay, so again, it's an investment in you. It's an investment in your ability to be able to do this career field properly. I'm just saying. So that's my advice. If you are still trying to decide which certification to get, as long as you get one of the four main ones to start with, the CCA, the CCS, the CCSP, or if you want to go with AAPC, that's CPC, you're good to go. But just keep in mind with AAPC, you're going to have that additional $205 charge every year that you have that credential, unless they go up. I'm just saying. So with that said, I'm going to wrap this one up. But thank you guys so much for joining me. I hope you all have a great weekend. I will see y'all again on Monday. Bye.